Now, earlier this month, the U.S. government proposed 2 new rules to help increase the availability of organs for Americans on the transplant waiting list. Here to tell us more about these new rules is Dr. Christopher Marsh from Scripps Green Hospital. Good morning to you, doctor. Thank you for taking time in to talk about what is potentially life-saving news.
Thank you, Paul.
All right, well, let's do the hits, runs, and errors. Talk about the 2 rules. Let's start with the first one. What is the change going to be?
Yeah, so this first rule is about living donors and reducing financial barriers for them. So as an example, as a kidney donor, the current insurance that covers the recipient's insurance covers the donor's medical bills, but nothing else. So it doesn't cover things like lost wages, elder care, child care, travel, things like that. So the intent of this is to try to provide a financial coverage for those things. Studies show right now that there are donors that come up, and when they start to think about how am I going to do this, I can't do this, they walk away. And so we need this kind of support.
And the second rule changes?
Yeah, so the second rule is about the organ procurement organizations. There's a number throughout the country. These are the organizations that collect the organs from deceased donors. And what we know is that there's a significant variability in their function. So what is being proposed is stricter rules and guidelines and data that will be collected, and rather than the organizations doing self-reporting about how they're doing, there'll be strict criteria, and then the government every year will look at that and look at the low-performing organizations and try to get them to function to the top levels. And when you see that variability, there's many organs that are just not being recovered, and we need organs to be recovered. There's about 113,000 people on the list, and as it stands now, about 20 die a day without an organ.
So the demand for organs exceeds the demand of people who are passing away or involved in accidents that can provide organs. The 2 categories are out of sync, right?
They're out of sync.
So you need to have living donors participating.
We do. Now, unfortunately, there's 7,000 live donors being done out of the 36,000 a year, but any incremental increase is needed, and these we think will help.
Well, these changes are impactful then, correct?
Yes, they should be. Anything to save a life is impactful.
All right, well, talk about from a medical perspective. People, obviously, if it's somebody in your family or that you match up well with, I don't think anyone raises an eye to, but say people who are down on their luck financially and now are going to be selling their organs, can you, as a doctor, are you okay with that?
Well, I don't think we're going there yet. Okay. But I think there does need to be an increased awareness about the opportunity, and we've had individuals who just want to do the right thing and be an altruistic donor. But again, we're trying to take disincentives away so people will be willing to do it, and there's many reasons. But increasing awareness of living donation will help. We think these regulations will help, and we'll see how it plays out.
So give us a timeline of these new rules. Are they in effect immediately, or
no?
Are they just being proposed?
They're there, and there's a 60-day period where they're out there for comment, and then they go into effect. So it'll occur soon, actually.
So what else besides these laws and rules changes? What else is out there that can?
What are we doing to use more organs?
Yeah.
That's a good question. So right now, other than living donors, we are looking at a variety of other types of donors, taking an HIV donor and putting it into someone with HIV. Now there's trends towards donors that are hepatitis C positive and giving them to someone that doesn't have hepatitis C. And you go, well, why are we doing that? Because now it's the cure rate with the new drugs is phenomenal. So if you can get an organ and not die, you've just saved your life by taking that type of organ. So, and the last is older donors. So we're using more older donors and putting them in older patients. transplant programs have been historically conservative for their outcomes, but if you're too conservative and you don't transplant an individual and they die, well, that doesn't help either. So those are 3 areas.
Look into your crystal ball. How's this all going to change in 30 years' time? Are we going to be creating the organs in a test tube and there won't even be a need for living donors?
Well, that's a good question. There's certainly work with stem cells to try and create organs, 3D printing, things like that. Probably in the near future it would be using genetically modified pigs organs.
For certain valves and whatnot?
Like
valves?
what we're doing for valves,
right.
But now they've modified pigs and knocked out certain genes to make them acceptable for human transplantation.
All right, so Joe Blow at home who is interested in this, either with a family member or close friend that is in need of an organ, how can do we have any influence over the political process as far as these rules becoming into effect?
Well, I think they're good. We'll see how this plays out, but I think they're good rules. I think more importantly, I think people that want to be an organ donor should step forward and at least be evaluated. Obviously, there's reasons they might not based upon social factors or just wage factors, but I think calling and, for Scripps, you can call and look into more information through Scripps.org or call 1-800-SCRIPPS and get more information, but anyone can be a donor.
I just, the transplant technology just in my lifetime has just made significant steps.
We do. We continue to, I think we're doing a very good job, but we need to continue to push. And I think at Scripps we're doing research in organ pumping, and we're going to be looking at stem cell augmenting kidney transplants, so you can go off immunosuppression. We just keep moving the progress forward in terms of our field. It's an exciting field to be in.
It must be very exciting for people who are just getting into it now to think what it's going to look like 50 years down the road.
Yeah, it'll be amazing.
It'll be, the surgeon will be a computer, right?
Well, it could be.
All right. Well, thank you very much for your time.
Thank you very much.
We certainly appreciate you.